Yes, good day today. We are continuing with the topic that we started yesterday. It was on arthritis. We said this thing. Okay. Okay. We're still continuing today. We are going to talk about osteo. When we talk about osteo, we usually mean about the bones. And it's the most common type of arthritis, and major cause is joint pain, stiffness, and reduced mobility, just like the other one. But the difference with this, the other one we saw it had something genetic. Even here we find some genetic measure, but we will not find some issues like we found the other one, which is rheumatic one. You see. So we'll continue. Remember, yesterday we talked about rheumatic arthritis, and infectious arthritis. They both shared some things, but they were a bit different because with the infectious arthritis, it was Jamaican uncle is in the house. Hi, Jamaican uncle. You are doing great. I'm doing great. Today we are continuing with the topic that we started yesterday, and it was about rheumatic arthritis and infectious arthritis. We all saw that arthritis is a general term that people look at, but the, below arthritis there are several types of arthritis, and we started by rheumatic one, which is genetic, and then we went to infectious arthritis, which we saw if treated early, it can be okay. We even brought in a factor of not typhoid, of TB, tuberculosis, which goes to the bone, and we saw how it affects someone and how a person can be affected with these infections. We saw what places arthritis is bound to. We saw places like the knees. We saw places like synovial joint, where is the primary place whereby the joint is affected. You see, every disease sometimes affect a primary place, and when it is a primary place like the joint, movement is disturbed. Now let's continue. We see what we can do today. Today we are dealing with osteoarthritis. Osteoarthritis is a major factor to increase in age, old age at times. You see, osteoarthritis is the most common type of arthritis and a major cause of joint pains, stiffness, and reduced mobility, especially in older adults, mostly in people that are old. Osteoarthritis is a degenerative joint disease whereby the protective cartilage that cushions the end of the bone gradually breaks down. You see, the cushion of the bone, I drew yesterday some drawings, and I showed you the cushion. Let me get this. And I showed everyone the cushion of, you see, this is the most common type of arthritis, and it causes joint pains, stiffness, and reduced mobility, especially in older adults. Osteoarthritis is a degenerative joint disease where the protective layer cartilage that cushions the end of the bone gradually breaks down over time. Let me draw the protective layer of the joint of the bone so that we can see. Sometimes it's good to put things in drawing so that someone can someone can know. You see, when you tell someone something without putting it in drawing, at times it doesn't sink. But when you do it in a drawing, let me draw something here. Maji, welcome to the platform. I'm seeing Jamaican uncle here. Maji, yes. Let's see how these things are. I want to draw them so that at least one can see the cushion, the cushion of the cushion. Now look at this picture. One, we have this bone here, and there is a line beneath. Now, osteoarthritis, we have said, is a degenerative joint disease where the protective cartilage that cushions the end of the bone gradually breaks down over time. So let's say this is the layer below it, below the red thing. That is the cushion of the bone. Is the cushion of the bone. It finally breaks down. Michael N in the house. Welcome, Michael N. Today we are talking about arthritis. We want to see how arthritis affects people and how you can get away from osteoarthritis. Yesterday we did rheumatic arthritis and infectious arthritis. So I've shown you the part of the bone that breaks down, the end of the bone over time leads to pain, swelling, reduced joint movement, and in severe cases, bone or bone contact. You see, now if this end, this cushion which is between this bone, if this cushion which is between this bone breaks down, finally this bone, let me put this here. You see, let me draw it from here so that you can know. If this cushion breaks down, finally this bone will look like this. We are talking about osteoarthritis. So this is the femur. This is the femur. This bone, femur. It's called the femur. Femur. So the bone is like this, but it has been eaten from this side. So it will finally come and touch. The two bones will come and touch each other like this. You see, and for you to allow an easy movement, you need this cushion which is in red. You get it? So what has been eaten is this end that cushions the bone. So here we are talking about osteoarthritis. Osteo meaning the bone is being eaten. The bone here is being eaten. You see? Now we continue about what can cause these bones to be eaten and what can make you be susceptible and can make you get osteoarthritis. Sometimes osteoarthritis, you can just get it when you have some risk factors. The risk factors for osteoarthritis that can make you get osteoarthritis. And we have said osteoarthritis is a degenerative joint disease. Degenerative. You get it? It eats itself. So increase in age is a fact. When you are going, the age is advancing, you are susceptible to osteoarthritis. Joint injury, for those that like playing football and you understand, most of them can get osteoarthritis. You see, it's very important when you are playing this football and American football, rugby, you guard your joints. Yeah? From sports, you get accident, repetitive strains, you get osteoarthritis, obesity. Now, if you have a big body, you see, big body is carried by your legs. So the bones of your legs, the joint bones of your legs, what happens to them? They start reducing. What I've drawn here, the joint here, they get a lot of pressure. So the cushion reduces. If you've ever heard about synovial fluid, the synovial fluid is what is here that makes it have a round cushion so that this bone cannot touch the two bones that are below. This one is the femur of your thigh, tibia, and fibula. There are three bones on your legs, and then there is a foot which has its own bones. Now, so when you have advance in age, joint injury, genetics, family history of osteoarthritis. Maybe your family history, you at times create weak osteoclasts. Osteoclasts are cells of your bones, and there are some others that are called osteoblasts cells. They are weak, they cannot create strong bones. You can get easily osteoarthritis. And then joint deformities, congenital or developmental. Some people are born with joint deformities that makes them have osteoarthritis because the way a bone is supposed to lie against each other, it is not like that. So it makes the bone be eaten. And then we see occupational overuse. Occupation, those people that work a lot when they are kneeling. You see, when you are kneeling, you are you are I need another paper. When you are kneeling, you see, this is what happens when you are kneeling down. When you are kneeling down, this is what happens. This is your leg, your thigh, your thigh, your thigh, and then your here, here, and then here. This is a leg of someone. So here we have the femur bone here, but these ones are the tibia and fibula down here. So when you are kneeling, you are straining this part of the leg. When you are kneeling, you are straining this part of the leg, this part. Here we have a small bone that is here, it's called the patella. Here is the tibia and fibula, the two bones, tibia and fibula. So when you are, sorry, there was a connection problem, but it is sorted out. I'm very sorry. There was a connection problem, but it is sorted out by the specialist. Now we were at sorry about that, everyone. The connection had a problem, but it is sorted out. Now, we were at causes and risk factors of getting osteoarthritis. Now, first one was age, second one was joint injury. You see, from sports, accidents, and so, and then we had obesity, and genetics, family history, and then now we have joint deformities, and the last one was occupational use. Occupational use. You see now, this one is when you are kneeling repetitively. What is happening? You are destroying the bones. That's why most of the football players nowadays, any exercise that involve kneeling and squatting is not done so much because of the bones of your legs that are brushing against each other or lifting when you go to the gym. Yeah? And you see, when the commonly affected joints you in osteoarthritis, mostly you will get is the knee, the hip joint, hands, and spine. There are some factors where the bones that are near the others, like the bones that are near others, like the femur and tibia and fibula, the bone of your I need some other papers. The bones of your hip joint. The bones of your hip joint. See, the hip joint is like this. Yeah? The pelvic region. And then we have the bones here, the bones. So the most affected bones of the spine is the lumbar part. The lumbar part. You see, here we have the femur. After trochanteric, here we have the femur coming like this. So this is your bones of your back. And you see, this is the bone that carries the whole of your weight here, here. So most affected bones are the bones of the spine, here, down, lumbar here, and the bones of your legs, because they carry a lot of weight. When they carry a lot of weight, you will see that they are degenerative, or maybe in your family, you have that, you are susceptible to arthritis. You have that factor. We have to know how these factors are related. This is called the pathophysiology of osteoarthritis. Someone may ask, why is it affecting just the bones? Why? Why is it affecting just the bones? You see, with the other one, which was the other one was rheumatic arthritis, we see primarily it is affecting the joint synovium. The joint synovium. The synovium is this place around the bone. The synovium is that part that has synovial fluid. But with this one, we see it is affecting the bone. So if it is a degenerative disease characterized by loss of articular cartilages, when I'm talking about articulating, it's the bones that are communicating and they have movement. And changes in subchondral bone. Chondral bone is here, where they are lying against each other, and varying degrees of synovial inflammation, wear and tear. So the other things that we have talked about, the other things like occupation, overusage of your bones, weight, they concurrently do wear the bone. So the chondrocytes in early stages, which chondrocyte are cartilages cells. We have bone and cartilage. Differentiate that. And between a bone and a bone, there is a cartilage. So normal, mainly extracellular matrix made by type 1 collagen and polyinsaturated. Those are proteins. They wear off. They don't have that strength to hold the bone. And then the cartilage breaks down. When the cartilage breaks down, what happened? The fourth one is there is a change in the bone. The bone starts to thicken and harden. You know, a bone starts as a cartilage and then it starts to thicken and harden. You see now, the cartilage that is between the bone now, because of every time wearing off, it starts to turn as a real bone. And you see, when it's because of wearing off, it turns to a tough thing that is not the bone. Instead of it being a cartilage, it turns to a tough thing that is not the bone. The chondrocytes of the cartilage, they die. Yani the cells of the bone, they die. They form a strong bone. You see, and that's why you will find that most of the people, when they have osteoarthritis, they have stiff joints. When they want to move, they pull their leg, because over a long period of time, the cartilage have weared off until it has started being hard like the bone. So it doesn't move. It doesn't enhance movement. This is now what is called osteoarthritis. When we come to cartilage being a bone, there is no reverse. You will not reverse unless you go to surgery they remove, they put an artificial thing. So we have talked about it, and we are continuing what makes a person be susceptible to these things. And we have said the commonly affected places are the knee, hips, hands, and spine. Usage of your hands and your spine. And we need to know the symptoms of osteoarthritis. What are the symptoms of osteoarthritis? Hmm? The first symptom, because this is we discussed about inflammation yesterday, and we talked about what is inflammation. We said inflammation is whereby the body is trying to help itself to from an injury. Welcome, Doreen Small. We are continuing with our topic of yesterday. You see, it is trying, the body is trying to help itself from an injury. So what happens when the body is trying to help yourself and you are injured? You get inflammation. Inflammation is equal to swelling. Where the bone is affected, or the movement has teared, the joint has teared off the cartilage, what will happen? There will be swelling. If it is your knee, it will swell. There will be redness. There will be redness. Why will it be redness? Because that place will be having an inflammation, and many things there are going on. You see, we saw the what is inflammation, and now symptoms will be pain, because an inflammation is equal to pain. If your nerves are doing the work that they are supposed to be doing, they must send a message of pain. Stiffness, because now the cartilages have turned to be tough. They have changed the chondrocyte now to osteocytes, the bone. You get it? Now, if the joints are tough, what will happen? A swelling will be there. Osteoarthritis. If you have ever seen a person with osteoarthritis, the bone wearing off, you will find that most of the places are swelling. Most of the places are swelling, and they are tough. They can't move well. And then if they move, you will hear some sound crepitus. Welcome, Roger Killer. Welcome. We are talking about osteoarthritis today. We are talking about osteoarthritis today. Now, crepitus, the sound. Have you ever seen a person or felt a knee of a person? As that person walks, you feel a sound that is coming out. You feel a cracking sound from the knees end. You see that? Please, as we watch, please like the video and share the video, because when you share, it increases impression, and someone may watch it, and wherever that person is, he may get help. So just like and share. We need to pass the message to many people so that some people can get help. Information is power, and if you have information, you may get help easily. So we continue with our topic now. The movement, and then you hear sound, it is called crepitus. So symptoms of an osteoarthritis person is this: gradual joint pain. One, because the bone like I've drawn, it has weared off. It is not like this, it has weared off. You get it? So it is gradual joint pain. If there is gradual joint pain, what next? What next if it is gradual point? Stiffness, because the chondrocyte, the cartilage, and the synovial fluid is gone. Now the cartilage turns to be a hard bone. You see, stiffness. You don't have a grease on your. We call them grease because in vehicles and machines we use grease. Now in human body it is called synovial fluid, not grease. But we use that so that people can understand. The synovial fluid has weared off. The cartilage has been tearing off for long, and now the cartilage is tough. It has changed from a cartilage to a bone. Stiffness is there. A bone that does not have synovial fluid, between your bones, in between your bones here, in between your bones, there is a fluid. This red part here, there is a fluid. The red part that I'm touching, there is a fluid there, which is called the synovial fluid. It acts as a cushion so that this bone, the femur, cannot touch the tibia and fibula, the small bones that are below your legs. You get it? But if it is where it wears off, what happens? This one comes in. They touch each other, and then the cartilage starts to be eaten. So when the cartilage starts to be eaten, what you get is stiffness, swelling, crepitus, the movement sound that you hear some people have in their joints, the crepitus. So if you hear of this, you'll know. If you feel someone's leg and you feel that sound, the crepitus, just know the synovial fluid is gone. And this person maybe is suffering from osteoarthritis, reduced range of movement. As you move, you feel pain, so you kind of like want to relax. In advanced stages, joint deformity and instability, you will not walk well. So, how do this thing come? In short, how do this thing come? In short, cartilage degeneration. The cartilage is lost. Hmm? The cartilage is lost. Loss of small cartilage surface is gone. And then the bone change, the cartilage changes, subchondral bone changes, the cartilage changes, hardens, cyst formation. It hardens and forms cyst formation. If a cartilage, you see, a cartilage is like a rubber. In Kenya, we call it bladder, a rubber that can allow movement. But remember, when it is put under pressure, it gets inflamed, and then there is some changes. When I say subchondral changes, I'm saying bone changes from cartilage to a bone. So the cartilage turns to a bone, and then you have a stiff. You see, this was the synovial fluid here, but it went off, and then here there was a layer of cartilage. There was a layer of cartilage here. So the cartilage acts as a barrier from these bones to this one. If it acts as a barrier, what happens next? This bone will start lying to this cartilage and bruising it every time. The bruising motivates subchondral changes. I'm saying subchondral changes is from a cartilage to a bone. A cartilage becomes a bone. If this is like this, if you move this, you will hear some noise, because this bone will be touching this. Any hard thing touching another one, there must be a noise, because now our synovial fluid is not there, it is bone to bone. And the noise, what will happen after that noise? Cartilage wears off, the bone starts to wear off, and then it will eat this bone. You see, if a bone touches another bone, it starts to remove, to wear off. So what happens after this? You start finding yourself having problems in walking. After subchondral changes, osteophytes formation, bone growth at joint margins. Imagine your bone where the cartilage is, the bone is growing. Synovial changes, mild inflammation in some areas. And then now, what can we do here? When you go to a hospital, they'll tell you to do some tests like x-rays. They find out what is happening, the x-ray. They will see reduced space between the bone. So they will know there is no synovial fluid, and then there is hardening. The osteophytes have become bone from you get it. And then there is cysts. Cysts are fluid-filled areas of pouch, fluid fields around that bone area. You see, those are the issues that we face when you have osteoarthritis. And you see, in osteoarthritis, in osteoarthritis, we have seen so much that here someone is not rheumatic factor positive like the other one. And in this factor, in osteoarthritis, we have seen again, there is no infection here. You get it? We have talked about heavy body, continued usage of your bones, your bones wrongly by doing exercises that are not supposed to be done, like kneeling, squatting every time, those things that make us susceptible. And then, when you grow older, immunity goes down and your bone density may reduce. So as you grow old, you reduce the workload that you do because of your bones, even if you have the energy. And then sometimes someone may ask, what happens? You see, what happens in osteoarthritis is, one, you'll get mechanical stress injury. The big body that lies on your joint, the exercises that you overdo, those are mechanical injury. You get it? Then the body itself has cells and some signaling that they call the cytokine. The cytokine comes in and then it brings the collagen, the cartilage erosion to a bone, and then your bone becomes stiff because now the synovial fluid is not there. You see here, the signs will just be like the ones of rheumatic arthritis, the sign. But when you go and see you check on the blood bone profile. Bone profile means they check on calcium, alkaline phosphate, and phosphorus. They'll find maybe your calcium levels are down. That's why your bone is weak and it's being eaten away. You get it? When you go to a hospital, they do the blood work. They do the blood works and they see that your rheumatic factor is negative. But at the bone profile blood work, they find that the calcium levels are down. Hmm? And then what next? Alkaline phosphate is increased because of the bone breakdown. You get it? And the phosphorus may be normal or reduced. So you will find that they will say, no, this one is not rheumatic arthritis. This one is osteoarthritis. So that's where you are given an injection, a particular injection that is called vitamin D3. Vitamin D3. Why? There was someone yesterday here that said he takes something. It's called that has called liver oil and D3, vitamin A, and vitamin B. So why does that guy get help? Oh, Kish Kish, I remember him. Kish Kish. Why does Kish Kish take it and is helped? Now, the injection that you are being given, vitamin D3, 300,000 units of 100,000 units, it's because D3, vitamin D3 helps to carry calcium to intracellular so that it can help build up your bones. So if you go and you're told your calciums are low, that's why you are having osteoarthritis, and then you ask them, why don't you just give me calcium? It's because even if you are being given calcium and your vitamin D3 is not able to work or it's low, you will not get the bone that is strong. You have to get a co-transporter. A co-transporter is something that carries what is needed to the right place, like vitamin D3 that is a co-transporter to calcium. That's why you are being given vitamin D3. You get it? Very important to even children that are being born with arthritis. There are some children, when they are born, their D3 is low and they are given that so that they can grow well with good bones. You get it? So we will go to a hospital, you do an x-ray, they confirm, but you have still to do the blood works, the bone profile and rheumatic factor to differentiate which type of arthritis. And at times, if your knees are swollen, they'll do uric acid levels to see if it is gout arthritis. Next, you are going to gout arthritis. Now, management. How do you manage this? Now, you have a big body that is making your bones weak. What next? You have to at least work on weight. Yeah? Exercise. But you see, exercises depend. You have said if you will do exercise that will always you are squatting, and you see what will happen? You will tear your knee joints. So exercise like swimming, cycling that have low impact on the joints is important. Yeah? Physiotherapy for muscle strengthening, very important, and joint support. So if you find out that your joint synovial fluid has gone and you can't replace it, you do knee supports. Knee supports are there, they help you to not to feel pain, or when you are moving, not to overuse the joints, the bones that are close. These ones. Now you have the problem, and then we have drugs that you can use, pharmacologic drugs. Panadol, acetaminophen for mild pain. You see, they stop prostaglandins from being released so that you can not feel pain, because pain is brought by prostaglandins. There's some hormones or cytokines that this Panadol stops. And then NSAIDs for inflammation and pain. NSAIDs are drugs like diclofenac and brufen. But do them with caution. Why? Because if you overdo these things when you have pain, you may build up acidity. There are some drugs that when you have problems with acidity, it will activate more and you will get more acidity. So you are treating pain and it is bringing another pain in your stomach. Hmm? Use some topical NSAIDs. The diclofenac, there are some topical that you can apply like creams, to reduce the inflammation. Intraarticular corticosteroid injection. This is something that I don't like using, but when it comes to an advance, there are steroids like that stops inflammation and pain over some time. But this one you have to do them with caution, because there is a drug that was overused that is called Diprofos. But you see that when some old people are injected, if someone is hypertensive, he comes with crisis, because now the injection activates more. But the pain will go down, but pressure will go up. And if you are diabetic, it causes more insulin resistance. So what happens? Your sugars are uncontrolled. There are some drugs of pain. If you are advised, you really need to think twice before you receive them, or you really need to have a talk with your doctor for good advice on using those drugs. It's not good to use a drug and then it brings another adverse effect for long. You get it? And then we have surgical joint replacement for severe cases. Yes, there are some surgical, it is called arthroplasty. Arthroplasty. You can replace the synovial fluid, you can extend the bone so that when you're walking, at least you have something like a cushion that is making the bone not to touch each other. And then we have osteomy or joint fusion in selected cases. Osteomy is to remove the bone. Hmm? See, if you have a question today, just ask the question as we continue. Today, we are dealing with osteoarthritis and gout arthritis. And then gout arthritis. Let's talk about, if you have a question on osteoarthritis, you ask. Now, gout arthritis. What is gout arthritis? People say that it's a disease of people that eat meat and alcohol. Is it true? Let's talk about gout arthritis. What do we know about gout arthritis? Is it only a disease of people that take meat and alcohol, or is it a general type of complication? Here we see gout arthritis is a metabolic arthritis caused by deposition of monosodium urate crystal into joints and surrounding tissue due to hyperuricemia. Hyperuricemia is high blood uric levels. You have high blood uric levels, uric acid. When you see you have gone to the hospital and then they tell you we want to check your uric acid because your joints are getting bigger, and if you touch you are feeling something. That thing is called a pasa of fluid. You know that they are trying to investigate if you have gout arthritis. But listen clearly, is a metabolic arthritis caused by deposition of monosodium urate. Monosodium urate. Hmm? The thing that brings the uric acid level at high level. You see, monosodium urate. Hmm? I try to call you. Now we continue. So what do we say? What do we say? It is deposited in the joints. Joints are really affected when it comes to this thing called arthritis. The primary places that arthritis, bones and joints. And why the monosodium urate that is deposited in the joints? Because that uric acid, mostly it helps when it comes to creation of synovial fluid. So over it, when you have over the normal uric acid, what happens? It becomes a problem. Metabolic complication. Deposition of monosodium urate in crystal and surrounding due to hyperuricemia. The crystal triggers intense inflammatory arthritis. So when it is deposited as a fluid, it changes into a crystal. Those crystals are called toffees, white crystals. Once a day, if you have ever removed a fluid from your joint and then you see some white crystals, toffees, they are called toffees. Just know your uric acid levels at times go up. So let's continue. Causes of hyperuricemia. Hyperuricemia is high uric acid levels. Hyperuricemia, high uric acid level. They can be there can be overproduction or underproduction of uric acid. You see, why do people call this a disease for people that take meat? This is why. Overproduction of uric acid depends on high purine diet. High purine diet is related to red meat, organ meats, and seafoods. Meats, high purine. Purines are broken down from proteins. Purines broken down from protein. So when you're taking meat that is a protein high diet, what does it say? You are producing more uric acid. And then there is something called excess alcohol intake. Excess alcohol intake. Beer and spirits. Beer and spirits produces high uric acid levels because of breaking down and dehydration in your system. The breaking down of DNA of your body brings uric acid. There is a difference. Someone asked me, is there a difference between urea and uric acid? This is the difference here, my friends. Urea is the filtered solution that comes out of your kidneys, then to the bladder for you to urinate. But there is uric acid that is produced by the dead DNA of your cells. They produce. So when you eat high purine diets, the meat that you are eating, it is a combination of DNA from that cow or something else. So they produce uric acid level, high uric acid. Hmm? And then there is something called tumor lysis syndrome after chemotherapy. If you've ever gone uh, with a journey with a person who is on chemotherapy of cancer, you'll find that there are sometimes he gets some fluids that just pops up from something. It is because the tumor is killing more DNAs and the fluid is coming out bulging because it has to go out. But here now we see, because you're taking high uric, you how purine diets like meat, the purines are supposed to bring synovial bleed. They are taken to your bones and then they are going to the synovial spaces. When they are going to the synovial spaces, the synovial fluid helps you to cushion the bones so that they cannot rub against each other. The bones of your fingers, the bones. But now the problem is it is overproduced and it is forming toffees. Monosodium urate. It is forming the toffees, white crystals. And the white crystals are the ones which comes out with the problem of inflammation and the problem of joint movements. Hmm? We were continuing with the causes of high uric acid because now we are dealing with gout arthritis. I'm explaining how gout arthritis comes in. Hmm? And the first cause we have said is overproduction by taking high purine diets like meat, organs, and seafoods. The next one is alcohol. I have explained, and I've explained about cancer and tumor lysis syndrome of chemotherapy, how they kill the DNAs and then uric acid is produced. And then there is enzyme defects. There are some people who have some little enzymes in their body, like HGPRT deficiency, that balances the uric acid in your body. If you have that problem, you better take care, because if you have an enzyme defect of HGPRT and you are continuing to take a lot of meat, you are creating more uric acid. You are drinking alcohol, you are producing more uric acid. So don't ask one day why friend a friend of yours or an uncle or someone A is always taking alcohol and has never got gout arthritis, but someone B has just taken alcohol for a short time and all of a sudden is presenting with, it's because the enzyme defect, that one of A and A has that enzyme in quantity and it is destroying and balancing the uric acid and monosodium urate crystals well, but B has less of the enzyme. You see, the first we have dealt with overproduction. Overproduction is high purine diet, excess alcohol, tumor lysis that is related to cancer, and enzyme defect. But the second one we have under erexation, most common in kidney diseases. You know, uric acid sometimes is filtered and goes back. But when you remove all uric acid from your kidney, because your kidney nephrons are destroyed and they're removing everything in your body, even including proteins, you don't have enough DNS because you are leading to excessively removal. Your kidney has a problem. So you have you don't even have the stores to help your synovial fluid to be replenished in your bones. So the bonds will not be tough. They will touch each other because they don't have cushions. They don't have lubricants. You get it? And then we have diuretics. thiazide and loop diuretics like flutamide, and HCTZ, hydrochlorothiazide, that is called thiazide. They remove excessive fluid plus the uric plus everything urea. So you don't have enough stores to create the cushions that are created by uric acid in the synovium. The synovial fluid cannot be created because you are always using diuretics. It is very important when you are in a drug called hydrochlorothiazide or loop diuretics furosemide, you get it, or other diuretics potassium sparing, to be consulting to your doctor after you get some funny responses from what you are undergoing. You see, it is very important because you may create yourself to get gout arthritis without knowing. Now, low dose of aspirin. You see, aspirin is a blood thinner. It stops one of the enzyme from doing its work, one of the factors. So when it stops the factor, you may get high uric acid. And then there is nephropathy. Nephropathy is nephrons of your kidney. When they are destroyed, they don't filter well your blood. They remove everything. The last one is dehydration. When you don't have enough fluids in your body, you can get osteoarthritis. Now, we continue and we see which, if you have a question, don't just keep silent today. You ask, please, let's ask questions, let's like the video and share to other people so that if they have questions or they can find this video helping, they can contact us at any moment they need. Our only chance here is to help people that don't have information, and you see on this platform it is very easy to reach people and give information. Now, risk factors, those people that are at risk of getting osteoarthritis. Male sex. You remember the other one was female sex? This one is male sex. Estrogen promotes uric acid excretion. Estrogen. Men you have. So women before menopause are protected. So estrogen in women is high before menopause, before it goes down. So it enhances, it promotes uric acid to be removed in your body to be removed, estrogen. But you see, male, we don't have it enough because we don't undergo the cycles that the women undergo. You get it? So male sex, we are at a danger, and we are the ones which like taking a lot of alcohol and meat. Every time we go meet up somewhere, the parties in the evening and the weekends, what is there in the jiko waiting for us? Meat. Slaughtered. You slaughter every weekend a cow because you have met as men and drinks are in the table. Be careful. Middle age. Middle age, people around 26 to 35. Family history of gout. I've explained some families have a problem with the enzyme that enhances the clearance or the balance of uric acid. High alcohol intake, that one I will not explain. You have heard about it. High purine diets. Diets with high purines like meat, meats. Obesity and metabolic syndromes. Obesity. See, when you are obese, you are storing so many cholesterols in your body, and you may find you are getting metabolic syndromes. Diabetes comes in, some kind of arthritis comes in, like this one, metabolic syndromes. You are susceptible to gout because of those. Chronic kidney disease. I've explained how kidney disease can. And then the people that have high pressures, and they are using drugs called diuretics and cyclosporin. Diuretics, have said, they are drugs that enhance fluid to be released from your body. Eh? So what happens? What happens to a person with gout? A person with gout, will have high uric acid, hyperuricemia, in the blood. So when it is in the blood, what happens next? Monosodium urate crystals form. They deposit in the joints, mostly joints that are away, like hands, legs, you see, like the big toe. Yes, crystal are phagocytes by neutrophils. You see, there are some cells in your body that helps in your immunity, and then they sense this one is not a normal thing. This one is a monosodium urate. It's not supposed to be here. They start eating it. And you see, when they start eating it, they promote more neutrophils to be created to clear that, to clear the monosodium urate crystals, the white toffees. This triggers inflammation. You remember inflammation, swelling, pain, you get it, hotness of the body, inflammation. It triggers inflammation because now when you have something that is not supposed to be somewhere in your body, there is some cells that senses no, we have to remove. And you see the triggering of inflammation, and you are still having high uric acid in your body, continuing to be high and high, more neutrophils are. So when they go and do something called blood count, full hemogram, we look, we see your uric acid is high, and then neutrophils are high, and maybe white blood cells are normal or low. You get it? We associate it with gout arthritis because we see the neutrophils are high because they are trying to clear the crystals. You get it? And then there are some specific cytokines, some specific mediators of immunity, cells that always come out when there is a problem. One of them is called tumor necrotic factor, something that helps you know to kill factors that can bring tumors in your body. They come out. They want to fight it. So when we do those tests and we find these things, we know there is a problem. This person may be having gout arthritis because now tumor necrotic factor is doing its work. Yeah, you get it? With repeated attacks, as you create more, you eat more meat, you eat more, you drink more alcohol, you create gout tophaceous, chronic tophaceous gout. You remember I've said monosodium urate crystals that are produced from high uric acid. They now turn to, because you are always taking meat and alcohol, you are, as a doc or the other doctor that you are with has told you to stop, and you are continuing to, they turn into white big crystals deposited on your joints, and the cartilage. So you start, if you touch your joints, they are always warm, swollen with some crystals inside. Those are monosodium urate crystals that are inside. But there are some stages. You just don't wake up and you start having it. What happens? Asymptomatic hyperuricemia. You are okay. You are going to parties. You are telling your friends and your relatives that with me, I don't feel anything when I take. Don't tell me to not to take because I get gout arthritis. Let me drink and take meat one. Let me party. Let me. That is called asymptomatic hyperuricemia. You feel pain a bit on your joints when you have taken in the morning after you have taken alcohol, and then you tell people, it was just an hangover, but I'm okay right now. It is called acute asymptomatic hyperuricemia. No symptom, but you have high uric acid. You wake up tomorrow morning, you are having some dizziness, some pain on the joint, and then it wears off after you've not taken beer or something for 2 days. You say you are okay, you don't have. Then it comes the second stage. whereby now it's acute gout arthritis. You have not taken anything, you have not taken alcohol, you are in office, you are at home, you are working, doing, forgotten about the parties. You get sudden joint pain. And mostly, if you look, because most of the metabolism happens at night, most of the metabolism happens at night, you will find that the people that complain about joint pains and inflammation, it is at night. Because that day you went home. Yes, very nice, very nice. Please like the video, like the video. Share to people. Let's have more people getting impressions there so that they can come and listen and we share ideas. You see, you've just got home, you have not taken alcohol for 1 week, but now your uric acids are always high, and then you have taken meat. So when it is being digested at night when you are sleeping, more uric acid are formed, and now it's a crisis. You remember, you forgot about the parties and so, and then you start asking yourself, I was just okay yesterday. What is happening? Why are my joints swelling? You forgot you have taken meat, and you've been taking beer for so long and meat, and today is the day that the crisis has come. You see, you don't remember whatever you took. Sudden it comes, you take some painkillers like NSAIDs, diclofenac, aceclofenac, brufen, cox B, you get better. Because when you take those painkillers, what they stop, inflammation is brought by some things called prostaglandins. When prostaglandins are stopped, the inflammation stops. So what happens? You forget. Yesterday was bad. My joints were so aching. Some people will relate that to malaria. Always a very bad diagnosis and impression. I had some malaria. You will even hear someone in Africa here. You will hear some people going to the pharmacy saying, I have malaria. Please give me anti-malarials. My bones are aching. Then a crooked pharmacist or someone will give you the anti-malarial because that person wants a sale. But I thank God for the countries that they can't sell drugs without a prescription or proper documentation, because that person needs help and you are doing help in the wrong way. So you give anti-malarial, that person takes, because he had taken some painkillers, he is okay. Then he continues with work. It comes a stage called intercritical period, symptoms-free interval between attack. You have one attack, you stay for some time after painkillers, another one comes. Remember, as you have those attacks and the pain is coming, what happens? You forgot that you are sick and you have high uric acid. You've never gone to the doctor. You always go over the counter to buy some painkillers. Those that are so cautious will always go to a doctor to find out, which is a very good thing. But the shortcut you make may be worse. And then, because you have not taken any, you have been just taking painkillers, it comes to the last stage called chronic tophaceous gout. Chronic tophaceous gout, whereby the high uric acid in your system for so long that has been creating monourate sodium, the crystals that I've talked about, have turned to tophies, the white crystals that I said. Long-standing disease with joint pain, deformity, and tophies. Guys, let's like the video, please. Let's like the video. Let's share the video. Because more people are suffering out there with gout arthritis, I know. Drinking is something that people do, and some people don't know. Maybe they don't have that enzyme that I said that brings down. And some people will ask you, yes, Marcia Thompson, welcome to the platform. There is a man who asked me, why is it that when I'm dealing with ladies, They don't feel bad with hangover like us men. Now everyone knows what happens, because some women, when you go and drink with them, you'll always see them going to the loo every time, every time, every time, and they don't get drunk faster. Ask yourself why. We have seen one of the causes of that is women have high estrogen levels that enhances the clearance of uric acid. And you see, when you have taken alcohol, we have seen it brings out high uric acid and some enzyme. And then the liver has the enzyme that destroys alcohol, hmm, so that you cannot be drunk so much. Just a minute, just a minute. A minute. I answer. This one is a private one. This one is a private one. Now, yes, we say we have seen the estrogen, the work of estrogen, enhancement of removing uric acid. But in the liver, for women, they have something called alcohol dehydrogenase. That is an enzyme that removes, converts ethanol into acetaldehyde, and acetic acid, and it makes someone not to get drunk. So we have seen arthritis from asymptomatic hyperuricemia. You don't have symptoms of high uric acid, acute gut arthritis, sudden inflammation of the joints, intercritical period, free from symptoms of a long time, to chronic period where you have deposits of toffees and white crystals in your joints. Now we go on. Please don't hesitate to ask a question. Ask questions. Let's learn. Let's continue to learn by asking questions. Let's continue to interact by asking questions, because maybe you may activate something that may be very helpful. I usually say one thing. There are some things that you may see being done in the societies. They are not medical, that but they help. Talked about cod liver oil, and it brought a topic, and we saw how it helps. So if you see something it's not medical and you practice it, don't bother asking. Just ask. Don't bother yourself from asking. Just ask, because it has maybe a medical side of it that people don't understand. Or maybe it is dangerous because it is keeping something that will come out to be big and people don't understand. So if you feel there is something that you see it being practiced and you don't really understand it, bring it on the platform. We talk about it. Yes, we continue on how you will look at a person and see that now this is a acute attack or chronic gout attack. What can you see? When you are in acute attack and then you hear someone saying, or yourself, I have pain on a single bone or toe or finger that is always disturbing that person, know that that is acute attack. Sudden excruciating pain in single joint, monoarticular. We say monoarticular, articulating joint. You know that is an acute attack of gout. Most common sites are first metatarsal joint, which we always call podagra. First metatarsal joint of your leg. I don't know if I can draw it so that people may know. The first metatarsal joint is it is the one that people always have a problem with the metatarsal is this one. This is your leg here. Your leg. Your leg. So this, the first joint, metatarsal joint. Here. Here, here, here. Here we have the two bones that link between each other, the two bones. And here we have the calcaneus. The calcaneus. So you see that. So if this is the calcaneus, the first bone here is the first joint. The first joint that is here. Let me draw it with red. This joint here. That one. That is the first point that the pain starts from. Every time you see a person complaining of this joint that I've marked, you know that it is the first gout arthritis sign that a person has. You get it? The first sign of alcohol attack. Most common site, swelling and redness and warmth. When we talk about swelling and redness and warmth, what do you understand? You understand that inflammation is ongoing. The body is trying to revive itself so that you are feeling pain and other things. Fever and malaise possible in severe cases. You are just tired because of high uric acid and body is just withdrawn. You don't have strength. Why? Because of high uric acid that is depositing monourates in your joints. Monourates, we have seen it is crystals of gout, high uric acid, crystals of high uric acid, often triggered by alcohol. These things are triggered by alcohol or meat intake. After you've just been on taking meat for long, you feel this. Or when you are dehydrated, you feel thirsty and you feel those things that I've said. Or you have just undergone a surgery and lost some fluid. You get that. Or someone has just stepped on your toe. It becomes very painful. You are looking at the problems that I'm talking about. And then we have chronic side. That one was acute, which is faster, but chronic now, you have not treated it well, and this is now the problem. It is continuous. Tophies are there. I've said tophies come to irregular chalky nodules, white nodules on your toes, elbows and knees. Finger Achilles tendons on your fingers. You at times feel that it's a boil with pus, but when you remove the fluid inside it, you see a white fluid coming out with white crystals. You'll know that is not a boil. It is very warm and painful, and it's white. Just know those are tophies, deposit of monourates, monosodium urates. And then why joint deformities? You get joint deformities because now your cartilage and tendons have started wearing off, and some of them have started being tough because the tophies that are crystals are doing what? Are deposited, and they are killing the tendons and the cartilage of your bone. This is now chronic. You have not been treated after the acute attacks. You have continually taken alcohol. You have continually taken meat because you are telling people you like it so much. It is very healthy. When you drink, you feel very nice. You feel like you are everyone. You can instruct everyone when you are drunk now. You have the cash now. You eat meat. because meat, you can eat it. Yes, we continue with this discussion. The tophies, the joint deformity comes in. Kidney stones, uric acid nephrolysis. Uric acid forms stones on your kidney. Hmm? If we will talk about kidney stones, because now we are talking about arthritis, we need to finish by talking about kidney stones. Stones, how are they formed? Because most people that have arthritis are always having problems with kidney stones. You see? Hmm? So we continue about it, we continue about this topic. It is very important to understand why we suffer some problems. So you see now, this is arthritis, but it is leading us to another topic called kidney stones, renal issues. When we are talking about kidney stones, now we go to renal issues. There was a time I talked about how the kidney works. So after this, after arthritis, I'll introduce a topic about the kidney only, and then we go to kidney stones. Then we go to chronic urate nephropathy. Now that it is associated with kidney stones, what comes in? What comes in is the nephrons of the kidney continue to get inflammation because they are being blocked by the stones, and you cannot remove them. They are not working well. Some fluid is being retained in the kidney. They start wearing off. Now, from your drinking problem with meat eating issues, now you've got gout, and then gout has taken us to kidney injury. Gout has placed at a place called kidney injury. We are dealing with now nephropathy. Nephrons are being destroyed. We are dealing now with kidney stones. You see how diseases take step by step as if you don't take advice. Hmm? Now we continue on how to diagnose or help. Hmm? When you come and your joints are swollen, I want to be sure what I'm dealing with. I aspirate, I get the toffee, monosodium urate crystal, the toffee, the white toffee. I check it on the microscope. I look at it very well. I examine that uric acid, that crystal well, and then I see needle-shaped negative birigent monosodium urate crystal. Hmm? Needle shape. They are very shaped well, like a diamond that has been cut. I look. I'm the doctor now. I've told the lab technologists, may I look at that microscope? I go inside, I look at it, and I see some cool, very cool shaped crystals. Crystals, needle shaped crystals. You may think someone or God cut them in a very good shape. Those are monosodium urate crystals. Most of them yellow when parallel to polarizer, blue when perpendicular. They look like some good stones. I know, oh, my friend today has gout arthritis chronic stage. Hmm? Other investigation, I check sodium uric acid, serum uric acid. Sorry, serum. I take your blood. I look at the uric acid levels. I find that wait, your uric acid are high. The uric acids are so high. There is the normal ranges. I know this guy has a problem. Hmm? You check on the x-rays on the bones, you see the bone deformities and erosions from the bone. You know that this is a big problem. We know we want to deal with it. So, what do we do on a particular patient? When this patient comes in, what do we do so that we can help? Because everything should be helped. The only thing we want a person to have is to be a normal body, a normal person, without high levels of uric acid and destruction of your renal issues in the kidney. Now, if it is acute stage, you just use painkillers. mm, indomethacin and naproxen, diclofenac, first line. You stop the pain, and then there is something called colchicine, inhibits microtubule, prevent neutrophil migration. Those ones help in pain. Corticosteroids, mm, oral, they help to reduce the pain. But this one, always use corticosteroids if in the hospital you are advised not to use NSAIDs like diclofenac because maybe you have acidity issues and ulcerations in your stomach. So you cannot just give someone drugs and you don't want to prevent the attacks or to stop this thing from going on. You will give someone these drugs, but you will tell this person, we change your lifestyle, my friend. Reduce alcohol. Yeah. Don't take alcohol. Take little meat or stop eating until you are okay. Don't have a big body. Go to the gym. Know how to reduce your body. Take a lot of water, rehydration. There are some drugs that will help you reduce the uric acid, like allopurinol, Febostat, and others, probenecid. You get it? And others that are called probenecid. They will help. So for long term, those are things that we should be using. Hmm? So we don't want to get to chronic complications like chronic joint damages, deformities, ulcers and infections, renal uric acid stones. No, we don't want to get there. Chronic urate nephropathies. We don't want to get there. Mm. Today, I am. People have been so listening without questions, and I think we have dealt with those things well. At least you know about uric acid and gout and osteoarthritis. So if you have a question that you can ask later, it is important to the platform that you just post the question because we learn and go on to continue learning more on how to prevent some cases. You get it? So if you don't have a question, I'm sure it's good we stop there for today. And then tomorrow we will do another one. We still have types of arthritis. Today we have done two. Yesterday we did two. Yesterday we did rheumatoid arthritis and infectious arthritis. Today we have done osteoarthritis and gout arthritis. So wherever you are, be blessed, everyone. We thank you on the platform. Always share the video at least. Tell your friend you can be helped here by our talks. If someone has a question, advise to come to the platform, we talk and we see how we can help. But if you have a private question, my email address, just ask it. Everyone has it. Email me, we help each other. So have a good day, everyone, and be blessed. Thanks, Kali MTN. Thanks a lot. Be blessed. Let's meet tomorrow at the same time.